we talked earlier about, we thought this was pretty brilliant design. I mean, there's another study that's called Remind, right? So Remind is where the more 2A investigators are basically looking at, it's a case control series where nearly 500 patients treated with single agent lenalidomide were compared to what happened to patients in the L-MIND study, the study that we just been mentioning. And so they really took a huge group of patients and really were able to do very careful matching between the two different studies. And in that study, it really looks like that L-MIND, the combination with lenalidomide and MOR2/8 did much better than the control lenalidomide. And so I think it's brilliant because it would never occur to me that in the past that this was a possibility of using this kind of real world data to use as a control for patients and get a therapy approved through the FDA. So I thought that was really exciting news. I think it opens up a lot of opportunities in drug development in general, not just for this drug, but trying to use this real world data. I mean, a lot of people have argued that these retrospective real world populations are actually much more important than what we're seeing in clinical trials because they reflect a much more broader group. Now, okay, in this case, they narrowed it down to make people that had to be essentially patients that were eligible for the L-MIND study in order to be the control group. But what did you think about the first time you heard about this, John?
Yeah, this was absolutely fantastic. This really was something we should be doing all the time, at least looking at real world data. I don't know what the real world is, but when you're identifying 500 patients who got single agent lenalidomide in relapsed refractory large cell lymphoma, these are people obviously that don't have great options because they're getting this off-label use. It's got to be meaningful, and as long as you can compare adequately. So you're right, they did compare, the 81 patients in the L-MIND trial to about 81 patients who are identified that were well matched. There's always, of course, biases and flaws there that are probably inherent, but nonetheless, as you said, the data clearly showed that the responses were inferior to single agent lenalidomide. They were only an overall response rate of about 40%. Remember, in the L-MIND trial, it was about 60%, maybe even a little bit more. And the CR rate, or the complete remission rate, for those people who just got single agent lenalidomide was about 10 or 12%. And in the L-MIND trial, it was, I think, 33%. So it's kind of hard to argue that those big differences are not significant in my mind. And, if you're going to be thinking about trying to salvage someone with a lenalidomide-based regimen, maybe this is a new, better alternative. So I actually was really encouraged by it, but maybe even more, and I'm wondering, in a real world comparison, retrospective analysis, if this is valid or not, but that data showed that there was an overall survival advantage for the people that got MOR208 with the lenalidomide compared to the lenalidomide alone. I don't know if that's going to play out in a prospective approach. We know that there's a lot of different factors that go into how people do with overall survival, but, do you agree? I mean, that seems like a pretty exciting thing, if you ask me.
I do think this is a significant difference. I'm reminded of the data with polatuzumab in combination with BR, that the difference is the numbers are really quite small. The number that people that actually were benefited from it in that trial were small in comparison to this larger data set in the L-MIND study and combining it and comparing it to the Remind data. So I think it's impressive. We will have to see confirmatory trials, I'm sure, ultimately in the future, probably moving this therapy in frontline setting in combination with R-CHOP. And so I think that's going to be a really important ultimate confirmatory trial and outcome. I mean, ultimately we'd like to move things forward in our therapies for large cell lymphoma because that's where the real difference is. I guess the other thing I'm impressed by is that this this therapy seems to be different than other CD19 antibodies. I mean, there's a couple publications with Medi 551 looking in combination with some of the salvage regimens for relapsed large cell lymphoma, and in that case, really no different than the rituximab containing regimens, and so that seems different to me.
Yeah, but that's early data. We'll see what that shows. It's a different approach. Maybe there'll be some important advances there. I would say the enthusiasm for anti-CD19 antibodies is very high, and I hope we do continue to develop other therapies in that regard.